Welcome back. Today we are going to see another NCLEX practice type of question where we are going to see the airway, breathing and circulation is not always the first priority. Now we are going to the question. A nurse is caring for 4 patients. Which patient should the nurse see first? A patient with asthma who is wheezing but has an oxygen saturation of 96%. B. A patient with chronic kidney disease who has a potassium level of 5.8 millicoulomb per liter. C. A patient with tracheostomy who is coughing up thick secretions. Number D. A patient who is confused and trying to climb out of bed without assistance. So we have to see all the options and we have to see the first option. So the question at first glance, the option A and C look like airway and breathing problem. So we always tend, and many students tend to automatically pick them up. But NCLEX wants to see the most immediate threat among these 4 options. And by seeing this, we can see and arrive at the option D. This is the right answer. Now we can see why it is other questions are not right. So says the patient with asthma who is having wheezing, but here the oxygen saturation seems to be normal, and this option is also not under priority, and this is not all that most important. That is option A. Option A and C looks like a breathing problem. Option B, that is potassium of 5.8, which is having abnormal lab report, but there is no significant changes or symptoms mentioned in the question regarding the ECG, and this is not most immediate. Next, in the option C, the tracheostomy with thick secretions, expected findings. These are the expected findings of a tracheostomy patient, and the patient is coughing, the airway is patent, and this can be managed and not an emergency. C, the patient is confused, a patient climbing out of bed, and immediately this is the immediate risk type of patient where we need to see the safety first. The higher risk for falls in such kind of patient and head injury and death can evade. So we need to select this option where the safety overrides the ABC in this NCLEX. So the NCLEX rule, what we need to remember is ABC only applies when the airway, breathing and circulation is actually compromised. If the patient is stable, look for safety. And as I said, always acute versus chronic, unstable versus stable. One line memory, what we can keep in our mind as a tip is great for NCLEX preparation is ABC only wins when it is unstable. Thank you.